Hi, this is John Fox, MD. I'm the Lincoln County Health Officer and one of the family physicians at Lincoln Health Hospital. Want to talk to you today a little bit about the COVID vaccines that are on the market and may be coming onto the market. The first two I want to tell you about are the Pfizer and the Moderna vaccines. These are what we call mRNA vaccines. A lot of people think this is something brand new, but these vaccines have been around since the 1990s. Certain animal vaccines, for instance, the rabies vaccine. So mRNA vaccines also have been developed for humans. In 2002, there was an epidemic called SARS, S-A-R-S. They developed an mRNA vaccine for that disease, but before they could get it all the way through research and development and into production, the disease disappeared. And as you might expect, there's really no market for a vaccine for a disease that doesn't exist anymore. So it got put on the shelf at that point in time. The nice thing about mRNA vaccines is they can be developed very quickly. And in fact, in January of 2020, after they had sequenced the RNA of the coronavirus, within a day, they actually had a vaccine made. And at that point, it was just a matter of producing enough and being able to develop the protocols for the research that took the rest of the time. These vaccines have been in existence. The ones we're actually giving have been in existence there for over a year. And they've been through phase 1, which says they're safe, they're not going to kill people. Phase 2, which proves that they're effective in a small group of people. And then the phase 3 trials are the ones that the FDA reviews. And for the Pfizer vaccine, they had about 43,000 people. The Moderna vaccine had a little over 30,000 people. The Pfizer vaccine in the vaccine group, they used ages 16 through 85. The Moderna vaccine was ages 18 and older. Both vaccines proved very effective at preventing coronavirus in general, about 95% effective, and they both were also extremely effective, even in those few cases, in those few people that did get coronavirus after having the vaccine. None of them got very severe disease, so hospitalization, ICU, intubation, or death. So it's very protective from getting the disease, number one, and number two, if you do happen to get coronavirus after you've had the vaccine, the chances of having anything very serious are very slim. The other thing is that these vaccines lower your ability to pass the disease on to other people. So they actually decrease how contagious the disease is from person to person, and also help to decrease the spread of the disease in that way as well. The Pfizer vaccine is 2 doses, 21 days apart. The Moderna vaccine is 2 doses, 28 days apart. The Pfizer vaccine, one of the disadvantages is that it has to be stored at a very low temperature, 103 degrees below zero. But they just got permission from the FDA, or they're seeking permission from the FDA to raise that temperature up to standard freezer temperatures, which is the same as the Moderna vaccine. If so, that makes the Pfizer vaccine a lot easier to transport and store. Both of the vaccines, once you have opened a vial of the vaccine, and a vial typically contains 10, occasionally 11 doses of the vaccine, but once you open a vial of the vaccine, all of those doses have to be given within 6 hours. And so what we're doing is we are gathering a list of 10 patients at a time, bringing them in and giving all 10 or 11 of those doses within that 6 hours. So unlike other vaccines that you can get just one at a time, we are doing these in small groups. We have given in this county over 2,000 total doses of the vaccine. Over 700 people have had their first dose, and over 800 people have had their first dose, and another 700 have had 2 doses of the vaccine. So far, in terms of side effects, there are a few side effects that are more common with the vaccines. I'm going to talk specifically, since we give the Moderna vaccine, the ones we see with the Moderna vaccine, things like fatigue, muscle aches, joint aches, sore arm, low-grade fever, headache, a little bit of redness on the arm. Notice that these symptoms are not the same symptoms as if you actually got the COVID disease itself. The vaccine, and all the vaccines, even the ones that are going to be coming out later, none of them have the ability to actually give you coronavirus disease. And so if you develop symptoms of coronavirus, that's the cough, shortness of breath, fevers, nausea, loss of taste and smell, if you get those symptoms after you've had a vaccine, you should be tested, because there is a good chance you actually have developed the disease itself. Again, you're not likely to get as sick, but the vaccine cannot give you the disease, and the side effects of the vaccine are typically very different than the actual symptoms that people get from the disease itself. The Moderna vaccine, like I said, it can be stored in a regular freezer. A lot of you are aware that the J&J vaccine is likely to be approved by the FDA this week, and in fact, it can be stored in a refrigerator. It doesn't even have to be frozen, so it's even got some additional benefit there. Pfizer vaccine, 2 doses, 28 days apart. Pfizer vaccine is 2 doses, 21 days apart. The Moderna vaccine is 2 doses, 28 days apart. Optimal protection against the virus is 2 weeks after you get your second immunization. When we look at the vaccine rollout, there's a lot of people that argue how we should or shouldn't be given this vaccine. But the decision was made to start with anyone over the age of 70 and frontline workers in healthcare. That decision was made because 78% of all the deaths that have occurred in the state of Colorado have occurred in patients that are over the age of 70. As we have gotten past that group, we've dropped down to age 65. We're doing essential workers, so teachers, we're talking about other frontline workers, and then in the very near future, I would anticipate sometime in the next 3 to 4 weeks, we're probably going to expand it to everyone. The bottom line is, if you want to get a vaccine, get your name on either our list with Casey, or you can call the county health nurse. Ryan is also giving these at Hoffman Drug. You can call and get on their list, and when we get to that particular group that you fit into, we'll give you a call and get you set up to get your vaccine done. When we talk about why or why not to get the vaccine, the reasons to get it, the reasons to say yes. One is to protect yourself, most definitely, but the other is also to protect your loved ones and those around you. These vaccines not only prevent severe disease, but they also decrease the transmission of the disease dramatically. Another reason is because you want to get the pandemic over with. It would be nice to have this whole COVID thing in our rearview mirror and open up businesses completely, so there aren't the same restrictions that we've been dealing with. And then for a lot of people, the biggest reason is to get rid of this mask thingy that we've been wearing. The question is, when will that happen? And people say, oh, that's going to be a moving target. It is going to be a moving target. But since the vaccines have rolled out, we are seeing, and this is a nationwide phenomenon, just not in Colorado, we are seeing decreases in the total number of cases, decreases in hospitalizations, decreases in patients in the ICU on ventilators, and most definitely a decrease in deaths. There will come a time, I'm anticipating this fall or this winter, where we get rid of the masks and go back to, and I'm going to put normal in quotes because we're never going to be normal again. This has changed all of us forever. But as close to normal as we can. And I anticipate that the sooner we get people vaccinated, the sooner that moment will come. People quote 70 to 75%. I want to make note, it depends on how contagious a certain disease is to how many people need to be immunized, or what percentage of people need to be immunized to give protection. The Measles Vaccine, which is the most contagious disease we know of in the world, requires 95% vaccination to provide herd immunity. At the level of contagiousness that this disease has, we're expecting 70-75% of people protected either through immunization or from having the disease should provide us with adequate herd immunity that we can start to do away with some of the regulations. The reasons for saying no, and these are valid reasons. Some people say, oh, we haven't tested this enough. Again, these vaccines go back to the 1990s with animals, early 2000s with humans, and the vaccines that we're actually giving at this moment have been around for over a year now. We have compressed the time frame. The normal time frame for developing a vaccine is 5 to 10 years. But the reason the time frame has been compressed is because of the severity of the illness and the number of people that have died. Over 500,000 people in this country and over 2 million people worldwide. So it is the compression, the short length of time has been out of necessity. That's my point of view. Does that mean we're not gonna find anything down the road with the vaccine? No, doesn't mean that at all. But based on the mechanism, based on how mRNA vaccines work, I do not anticipate any long-term side effects down the road. It's true though, we don't know about side effects beyond a year at this point in time. We also don't know whether we're going to need to do boosters, and that remains to be seen. This might be a one and done and you're good forever. This might be something we need to get boosted every year, every 5 years, every 10 years. That remains to be seen. There are some people that just don't think we should have immunizations at all. They think we should get the disease and develop our immunity that way. The fact of the matter is that the immunizations, the COVID immunizations, both the Pfizer and the Moderna vaccines, provide you with 200 times greater immunity than actually getting the disease itself. So they are very protective, more protective than actually getting the disease in this case. So, I get that some people just don't like vaccines, but these vaccines are more protective than having the disease itself. There's also some concern about some of the new variants that are out there, specifically the UK variant, the South African variant, the Brazil variant, and now the variants are starting to marry each other. So we got a California variant that's hooked up with the UK variant. Know that viruses, one of the things viruses do is they mutate, they change rapidly. The flu virus does this every year. The flu shot you get is different than the flu shot you got last year because we're trying to protect you against the strains that we're seeing. So the fact of the matter is, one of the things we have done before is we have rapidly developed vaccines. There's a different flu vaccine every year. But with the coronavirus, we don't know yet whether we're going to need boosters or whether we're going to need to change the vaccine. So far, both the Pfizer and Moderna vaccines have been very effective against all of those variants. One of them that you'll hear it quoted, well, it's only 1/6 protective against the variant as it is against the original strain of the coronavirus. And know that there's over 30 strains of coronavirus out there. This particular coronavirus, the COVID-19, the SARS-CoV-2 virus, out there already. But if you do the math, that means that the vaccine is still 30 times more protective against those variant strains as they are against the original strain. So still very, very protective. And Moderna actually has just, they've produced their first vaccine against one of the specific variants. And they're actually going to begin phase 1, 2, and 3 testing on that. I do want to mention briefly, when we talk about phase 1, 2, and 3, we also sometimes leave out phase 4. Phase 4 testing of a vaccine occurs once it is given to the general population. So right now, right this minute, we are in phase 4 testing of the coronavirus vaccines. These are some of the most tested vaccines in history, and we'll talk a little bit more about that in just a minute. Another reason not to get the vaccine is some people are concerned about the effects of the political process on the vaccine production. And I just want to mention, I've been very, very proud, and I'm not always, but in this case, I've been very, very proud of the pharmaceutical companies. They have resisted the urge to move this along more quickly or not do adequate testing. They made that pledge early on. One of the companies, Merck, has actually pulled their product off the shelf before they ever got done with their phase 3 testing. They said it's just not going to work, and they've pulled it off the shelf, so it never made it to market. The FDA has also done a very good job of vetting these vaccines, looking at the data and reviewing the data and saying, yes, they're safe, and yes, they're effective, and let's give these vaccines. So even with the political pressures that have come to bear and the political differences we have, from my standpoint, I try to always put the politics aside because I'm a doctor, and this is about medicine to me. And so from my perspective, the politics has not affected the process of developing and marketing these vaccines. The politics may have pushed that process to the max to get it here sooner than it would have otherwise, but it has not done it in a bad way. Again, some people think this is too rushed. We have compressed that time frame that we normally do for vaccines, but from my standpoint, we have enough information at this point to say they are safe and can be used safely. There are several other vaccines on the market. The J&J vaccine is likely to be approved this week. It's a one-shot vaccine. One of the things that I will mention about that vaccine is you're hearing that it's not as effective. It's only 70% effective. Remember what we're trying to prevent. We're trying to prevent death, hospitalization, being on a ventilator in the ICU, and long-term permanent complications from COVID. The Moderna vaccine, the Pfizer vaccine, both have already proven that. The J&J, also known as the Janssen vaccine, may not be as effective at preventing COVID, but it is every bit as effective at preventing severe COVID disease. And it does, just in the last couple of days it's come out, it also does decrease the ability to pass that disease on to the next person. So decreases the transmissibility of coronavirus. It takes a little bit longer. It takes, I think it's like 7 weeks after. The advantage to J&J is it's one dose. It is a different vaccine. It's what's called an adenoviral vector vaccine. And that just means that they've taken parts of the virus, attached it to an adenovirus, this is a common vector for a lot of the vaccines we get every day. And that allows our body to be exposed to coronavirus without actually getting the disease, and then we mount an immune response. So it takes a little bit longer. It takes about 7 weeks, but at that point it is equally effective as the others at preventing severe disease. It does decrease the transmissibility. J&J is actually looking at going to a 2-dose vaccine. That's in their current research and development as well, to see if 2 doses actually boost that 70% up higher. The J&J vaccine is not as effective against the variants as the Pfizer and Moderna vaccines are, but again, in terms of preventing severe disease, it does measure up. There's a couple other vaccines. There's a Chinese vaccine that they did their phase 3 testing on their military. There's a Sputnik, that's a Russian vaccine. They tested on their general population. They did their phase 3 test on their general population as opposed to on a smaller group like we did. So in this country, I've been very proud of the way we have produced, done the research, produced these vaccines. Distribution is going okay. I mean, I'd like to have enough vaccinations to give to everybody today, but that's not the reality of the situation. Our doses continue to trickle in the neighborhood of 100 to 200 every week or two. We're getting them, the county health nurse is getting them, and Hoffman Drug is getting them. And so feel free to check with any of those people in terms of getting an immunization. The other thing I want to touch on is side effects. So when you get a side effect from a vaccine, any vaccine, that is your immune system responding to being exposed to that vaccine. And so in some ways, we should look at that reaction as a positive thing. But the fact of the matter is that those symptoms tend to be a lot milder than the disease, and they tend to be very short-lived. Some people who got the coronavirus vaccine within a week or two after having had coronavirus experience relatively more reaction to the vaccine. That's because their immune system was already revved up. Just a word about that. I do recommend if you've had coronavirus, you wait at least 1 month after you're out of isolation before you get the vaccine. If you want to wait a little longer, I'm okay with people waiting up to 3 months. But at that point, I think you should be thinking seriously about going ahead and getting the vaccine. Those symptoms that, even the more severe symptoms, fever, chills, body aches, fatigue, typically those symptoms are lasting 1 to 2 days at the most, and then the person feels entirely back to normal and they're back at whatever they were doing before. Again, the having had the vaccine, it will not cause you to have a positive test for coronavirus. And if you develop symptoms of coronavirus after you've had the vaccine, it's probably because you've been exposed and have gotten a case of coronavirus, and I would recommend that you be tested. Normally, we have had what's called the vaccine adverse event reporting system. That's where when you tell me something happened after you got a vaccine, we send a report into the government. This vaccine, we still do that with this vaccine, but when you get your vaccine, you're going to be offered the opportunity to put an app on your phone that will send you a questionnaire periodically, very short, not very time consuming, but a few questions to answer. And also that app allows you the ability, if you say, hey, I have a symptom that that's not on this list of questions you sent me, that you can report this. It's called the vSafe. It's real-time cell phone technology, and it is actually allowing us to gather more data, more information on these vaccines than any vaccine in history. And so far, in spite of that vast feedback network, we are not seeing anything different or more severe than we would expect. In fact, the rate of anaphylactic reactions, so you've heard about that, those are the really severe reactions where people can't breathe, their blood pressure drops, they have to get a shot of adrenaline to reverse that. That risk is exactly the same as it is with any and every other vaccine that we give. It's 4.5 out of a million. And that's a like 0.0004%. So that's and because we give immunizations and have for years, we're always prepared to treat that reaction if it should occur. So just know that that severe anaphylactic reaction is exceedingly rare, but we are prepared to deal with it if it should occur. One thing about the vaccines, they've not been tested in pregnant women, but as happens sometimes, some of the women that were in the trials got pregnant during the trials or delivered during the trials, and there appear to be no adverse effects from pregnancy or breastfeeding, either one. The fact of the matter is that the disease COVID can cause problems with pregnancy, including miscarriages and stillbirths. And so even though it's not been officially tested in women, the few women that have had it during a pregnancy have had no complications. And the American College of Obstetrics and Gynecology actually recommends that women go ahead and get that vaccine. Another concern that some people have had, or rumor that some people have heard, is that these vaccines will make women sterile. They will not. Likewise, they will not make men sterile. So that's one complication that we do not have to worry about with these vaccines. Another rumor that you hear going around is that they're live vaccines. They are not live vaccines. They're not even killed vaccines. This is the mRNA vaccines have been a way to introduce our body to this virus without us ever being exposed to the actual virus itself. Just for the record, there are no microchips or nanoparticles in these vaccines. No one is going to track you. The only way you're going to get tracked is if you agree to have the app on your phone that tracks people's side effects from these vaccines. There is nothing in the vaccine itself. No one's going to be able to hunt you down because of anything that's in the vaccine. That's about all I have. If anyone has any questions, please feel free to call the hospital, ask for our office. You can check with Joe Beth at the county health department. You can check with Ryan and his staff over at Hoffman's. But feel free, if you ever have questions about the vaccines, to give us a call. We're more than happy to talk with you and chat with you about these. Thank you very much for your time and attention.